Yeah. I am Dr. Muntaqa Umar-Sadiq. I'm the National Coordinator of the Nigeria Health Sector Renewal Investment Initiative, the sector-wide coordination office. So the sector-wide reform program really responds to the significant fragmentation, the limited coordination between federal, states, and local government, and the lack of a unified accountability framework to ensure that all stakeholders, federal, states, local government, private sector, and academia, row in the same direction to get us to achieve our priorities to dramatically crash maternal, newborn, and under 5 mortality. Our thesis is that if we ensure that states lead, identify their priorities, drive government leadership, drive state-level ownership, and enhance the efficiencies at the front lines, that these elements would enable us as a country truly accelerate improvements in health outcomes. We seek to do this in 4 ways, which we have tagged one plan, one budget, one report, and one conversation. Under one plan, we have worked with states to ensure that we capture the state-level annual operating plans, which prioritize the important drivers of obstetric complications and deaths at the front lines. So the priorities of the Nigeria Health Sector Renewal Initiative, everything from revitalizing BMONC facilities, revitalizing CMONC facilities, ensuring that the referral linkages are in place, ensuring that there are emergency services within priority local governments are there, and also that the financing and affordability to access care happen in a more coordinated manner at the front line. All of these important elements are captured within micro plans in facilities that build up to annual operating plans. In addition, at the federal level, we have important incentives that we hope will ensure that subnational action in line with these country priorities happen. So one of the important tools of the sector-wide approach that we have deployed in the context of Nigeria is really this compact that the federal government and all 36 plus 1 state governors have signed. This compact outlines both the offers and asks, but also the core indicators that represent the important priorities that we want to focus on as a country that would help us dramatically crash maternal and under 5 mortality. These indicators represent what we call our one source of truth. So it's the basis for the quarterly performance dialogues that we have with states. It's the basis for the state-level LGA performance dialogues that happen so that we're all rowing in the same direction. It's also the basis for our portfolio reviews of spend and expenditures to ensure that resources align with the unmet need in our annual operating plans. Finally, it's also at the heart of our joint annual review. So as a country, when we take stock of our performance and seek to course correct to ensure that we are constantly looking at the indicators, at results, so that we're making decisions to how that enables us continuously improve the quality of the care delivered at the front line. So we have identified that the fact that despite significant investments in the health sector, we're not seeing commensurate results in terms of health outcomes. We have recognized that the underlying issue is not necessarily a technical or a financial problem. Yes, those contribute, but at the heart of our issues really are around governance and leadership, better coherence and coordination that is required, the lack of a unified accountability framework. Now, to advance these sorts of landmark sector-wide reforms at states and local government levels, we have outlined certain expectations. Everything from performance dialogues at the state level to resource tracking and one budget portfolio reviews to ensure that resources flow to those priorities. We have asks and offers that relate to not just AOPs, but having one conversations at the state level as well. We have expectations in the compact around ensuring that we revitalize a number, or we double the number of revitalized BMONC facilities, CMONC facilities, that we deploy community healthcare workers, that we have digital infrastructure. So to be able to bring all of these expectations to life, it is important that we build the capacities as well as the tools of state-level actors, and to ensure that we do that in a way that is sustainable and institutionalized. So the train of trainers that we're having here today seek to lead that social epidemic so that we begin to cascade all of the skills that will be required to bring this reform to life. Everything from problem-solving skills to ensure that the coordination at the front lines for MAMI, whether it's BMONK, CMONK, emergency, digital infrastructure, community healthcare workers, that change management happens, to the health financing skills that will be required, to leadership at the front lines, stakeholder management, and all of the important tools to identify problems, to ask the right questions, but to generate new knowledge, because we think that at the front lines, the solutions can be curated and can be the basis for actually developing new knowledge and helping enhance the space when it comes to health outcomes in Nigeria. I think my message is quite simple. I think that there is a collective responsibility that we all have to drive a country-owned, government-led, sustainable reform program. We are all in this together. The skill sets and the knowledge that we gain can really be the basis for new knowledge generation and can be the basis for accelerating improvement in health outcomes. That ultimately, all that we do, ownership means that whatever language that is required to spread this message, whatever approaches that is required to help build the skills of others, we need to think outside of the box to ensure that we provide that convergence between the new processes and the kind of outcomes that will be needed to drastically reduce the deaths of mothers and women in the country.